What happens in the exam room between the small talk and clinical exam is key if you want to increase your conversions and ultimately help more people. What do you usually do after you go into your new patient exam? You probably know that you need to connect with people, you need to make them feel comfortable. You probably do some sort of small talk. Hi, Mrs. Smith. Hi, Johnny. How are you doing? How was the summer break? What did you do last weekend? Something small, right? The small talk. And then what you do? I'm Dr. K. I'm going to take a peek in your mouth. And then you go straight to a clinical exam. You do a little bit of social history, you go straight to clinical exam. This is a huge missed opportunity that I see with so many of you guys. And what I'm going to teach you today is going to bridge that gap and will help you, one, convert many more patients. I've seen my clients go from 60% conversions to 85% conversions in just 1 week, after just one call. When we dive in deeper into my power framework, and today I'm teaching you one of them, part of the W, part of the exact words that you say. When you nail this, you will help so many people in your community obtain excellent dental care, because that's what you're providing. You are a person, you are a doctor with integrity. You don't overtreat. You provide excellent care. You're not perfect. Not all of the cases are perfect. They never will be. You will always strive to improve, and you will, but you will never have every single case that is perfect. Perfection is unattainable in medicine and in dentistry. That's why it's called the practice of medicine, the practice of dentistry. So, and I don't have to tell you this, you know to continue growing, you know to shoot for the stars, but in the reality is we will never be perfect. This will never be a case where every single case goes perfectly well. So, you are denying public right now, but by not doing what I'm going to tell you, what I'm going to teach you in this episode, you are denying public an excellent dentist, an excellent orthodontist, an excellent periodontist, an excellent general dentist. You are denying them access to your genius and your skills by not doing this one simple thing. It's a subtle shift that makes huge difference. It's that 1% that takes you from 99 to 100. It's just 1%. Seems so small, but the effect is massive. That is what I'm teaching you today in this episode. So let's dive into it. I mentioned that you don't want to go from the small talk, hey Johnny, hi Mrs. Smith, how are you, straight into clinical exam. What you want to do in between is you want to dive in to the reason why they're here. But Jana, I know why they're here. I looked at the medical history. I know the chief complained. Wrong. You need to go deeper. You need to dig. You need to figure out why they're here. Truly, what's the deeper underlying thing? They are not going to put everything on the medical history. They are not going to tell everything to your treatment coordinator, your assistant, or whoever does the intake. They will not. Patients tell doctors more information than they do to their staff. Fact. So it's up to you to dig in deeper. And here's what you're going to do. You're not going to glow up. You're going to sit with them face to face in front of them. And you're going to say, Mrs. Smith, I read what you put on the note, on the chart, why you're here, that you're interested in an expansion for your child, that you're interested in a new crown. But I want to dig a little bit deeper. Tell me why now. And pause. Tell me exactly what brought you here. What specifically about our practice is what attracted you? You are not just doing market research, one of those, did you find us on Google, refer a friend, so we know where to market. It's not about that. It has nothing to do with marketing. It has everything to do with you are wanting to understand the drive that your patient has. And it's going to do two things. Number one, it's going to engage your patient, because a lot of our patients come in and they just abdicate our responsibility to you. And then they become a nightmare to work with. How many have experienced that? Say yes. The patient comes in and they cross their arms and they're like, okay, go. And then you're trying to show them the crossbite or the lesion or the recession. And they're like, yeah, whatever you're going to sell me. They're skeptical. So when you probe deeper, you are engaging that patient and their care. What I taught to you last week is that the reason why the patient is in your new patient exam chair is because he, she, or the parents want to say yes to you. That's why they're there. Nobody just randomly walks into a dentist's office on a Tuesday afternoon for a check. That doesn't happen. It's a lot of effort to get there, especially if the patient is a child. So they are already there and you want to go deeper beyond, I want a new crown, or his teeth don't fit in his jaw. He has crowding. What made you think, Mrs. Smith, about crowding? Why now? Why is it a good time? Tell me more. Do you know what we're specializing in here? And your practice has a competitive edge to other practices. There's something that you do that's different from other practices. Maybe you specialize in airway. Maybe you specialize in sleep medicine. Maybe your edge is extreme comfort. Maybe your edge is technology. Maybe your edge is they're women-owned. There's something about your practice that's different. Maybe you're very high-end. Help me understand, Mrs. Smith, why you're here, and listen. This is key. Remember, I said it's going to do two things. Number one, it's going to engage your patients. So now they are actively partaking in their treatment. They're not just a passive passenger that you have to convince and then drag and motivate through treatment to do their part. Because let's be honest, we're not gods. We can do the most excellent work, but there is no compliance from the patient. And I don't care what specialty you're in. If there's no compliance from the patient, your treatment will fail. It's not going to work. This is the reality. So you need to have a buy-in from your patient, and you do this by asking these questions. So engage is number one. Number two is you're activating them. You are activating their internal buying trigger. You're activating that excitement about treatment. You're activating that destination. Why are they here? It's not just about straight teeth. It's not just about healthy teeth even, or a new crown. Why did you live with this crown for months and for years? Why right now? It is because they're newly divorced and they want to start dating. It is because she's graduating high school and she's going to college. It is because the kids are finally out of the nest and now she can prioritize herself. You need to know that reason. That reason will instantly connect you with the patient as the person who cares the most about them. It will engage the patient. So now it's not just you telling them, Mrs. Smith, you need this, but the patient is now engaged. The patient is in the movie of the flow of the exam, and it's going to activate them to follow up with treatment. The mistake that most doctors make is to educate only. It's not enough. It's boring. It doesn't land. Just listing a gazillion of reasons why somebody needs something is not going to convert a new patient. We don't buy things we need. We love to buy things we want. We buy things we need because we have to, Nobody loves buying toilet paper. We need toilet paper. But we love buying a Chanel bag. We love buying a vacation. And when it's not quite within our budget, we're going to make it work because of the destination, because of that. What are we after as a final outcome? That, my friend, is the micro change that you are missing in your exams that will create instant conversion, instant patient buy-in. It will create your best patients that are engaged, they're not missing appointments, they are not helicopter, they're reasonable, but they're doing what you're telling them to do. It's the best situation on both fronts. And if you're missing that small but such crucial piece between just walking in the room and making small talk and jumping into your clinical exam, it will cost you conversion. It will make new patients walk away and leave your office. This is what's creating patients who after you've done this beautiful, thorough treatment plan, even quoted studies, showed them the results, drew things on the board or on the exam presentation, and then their objection is, this is too expensive. And then this very patient goes to another dentist down the street the same day and does pay in full or down payment of $3,000. That's why. Because you haven't addressed that internal buying trigger, which is, why are they here? Why today? Of all days, why did they decide to prioritize their dental health, their sons, daughters' dental health? Why now? Dig in deeper, my friend. It's gold for both, for you and your patients. See you around.